Hello, today we're going to talk about the dental anatomy of teeth. Here we have two arches. Can you see? This is the upper arch and this is the lower arch. Okay. Here we have, in case of permanent teeth, we have 16 teeth upper and 16 teeth lower. In case of deciduous dentition, we have 10 teeth lower and 10 teeth upper. So let's talk about permanent dentition today. We're going to talk about the number of teeth in the upper jaw. We have here 16 and lower is are 16. So here we have the midline. Can you see here? This is very important to know. This is the midline, okay? And the mesial surface here, this is the mesial surface which is close to the midline. This is the mesial surface of the tooth, okay? And this is the distal surface which is away from the midline. This is the distal surface, okay? So it's very important to know the midline of the upper and lower jaw. And then we're going to talk about the buccal surface. So this is the buccal surface for posterior teeth. We call it, these are the posterior teeth. Here we call it the buccal surface, okay? Which is close to the buccinator muscle, okay? The buccal surface, okay? And we have also, we call it the buccal surface is for the posterior teeth. In case of anterior teeth, we call it labial surface. We call it the labial surface. So this is the labial surface, okay, for anterior teeth. In case of lower or mandibular teeth, let's look at the mandibular teeth here. Okay, we have here, these are the anterior teeth, 1, 2, 3, okay? So we call them anterior teeth. These 3 teeth, we call them anterior teeth. And then we have, these are the posterior teeth. We have 2 premolars and then we have the molars. In case of this jaw, we don't, the wisdom teeth is absent, okay? So but we have in normal jaw here there is posterior teeth, okay? We have the wisdom teeth, okay? So let's talk about the lingual surface here. This is the lingual surface, okay, which is close to the tongue. We call it the lingual surface. This is the lingual surface, okay? And then in case of which is close to the tongue, in case of mandibular teeth. In case of upper, we call it the palatal surface. We call it the palatal surface, which is close to the in the upper maxilla and close to the palate, okay, which is in the palate, okay? We call it the palatal surface. We call it the palatal surface, okay? And here we call it the lingual surface. Here we call it the lingual surface, which is close to the tongue. That's why we call it. So we talked about 2 things now. We talked about the buccal surface, okay? This is the buccal surface. This is the buccal surface for posterior teeth. And then we have the labial surface for anterior teeth, okay? And then we talked about the lingual surface, okay? And then we talked about the palatal surface for maxillary teeth, okay? Maxillary teeth. Okay, let's look at, it's very important to know the number of roots in doing endo, okay? So let's look at the single rooted teeth. Single rooted teeth are, and in the we find it's found in anterior teeth, which is the central, lateral and canine, okay? 1, 2, 3, okay? These are single rooted teeth. Mandibular premolar, mandibular premolars, okay, also are single rooted. Let's look at here. Let's look at this here. This is a single root. This is the, okay, we have here, this is the anterior. Here we have, this is the central incisor, okay, okay, this is central incisor, and then we have the lateral, okay. There, can you see they are single rooted, okay. This is very important when while we make endo. Also we have the canine, also single rooted, which is one of the biggest longest tooth in the oral cavity, okay. This is really important, okay. So this is these are the three anterior teeth, so they are the three of them are single rooted. And then we have mandibular premolars, also the mandibular premolars, these are single rooted. Can you see, single rooted, okay. First premolar, second premolar, also single rooted, okay. And then we have the maxillary second premolar. The maxillary, let's look at the maxillary second premolar. Maxillary second premolar is also single rooted, okay. This is really important while we are making endo, in order to know if it's single rooted or double rooted, or okay, or there's two roots, or if there are two roots or three roots, okay, okay. This is really important, okay. And then we have the two root with bifurcation, okay. The mandibular molars, we have here the mandibular molars, two roots. Can you see here, two roots, and this is the furcation, this is the bifurcation, okay. So the mandibular molars are two rooted, okay. So with bifurcation, so two root with bifurcation in the mandibular molars, okay. We have here, this is the first molar, and then we have the second molar, also two roots. Can you see, this is really important while making endo, okay. Can you see, okay. Let's look at the maxillary first premolar. Maxillary first premolar, this is an exception here, okay. It's double rooted, okay. It's two rooted with bifurcation, okay. This is the maxillary first premolar, okay. This is while one of important points here I want to tell you about. It's really important while extraction because of the two roots. So we do it so slowly because of the fracture that might occur here, okay, due to the two roots. Three roots with bifurcation in maxillary molars. So let's look at the maxillary molars. This is the maxillary molar, okay. We have three roots. We have here three roots. Let's look at this is number one, first molar, okay. Can you see here, these are, we have two roots, buccal, okay, and one palatal, okay. So we have how many roots here, three roots, okay. This is really important. So two buccal, okay, and one palatal. So this is the first molar, maxillary molar, and this is the second maxillary molar. Also we have three roots. We have two buccal, can you see, two buccals and one palatal. Normally the palatal, it's long, a little bit longer than the two buccal. So we take care while making an extraction in this tooth. This is really important. So okay. So here it's very important also to know the surfaces here. We have biting surfaces here. We have, this is we call it the occlusal surface for molars, okay. For posterior teeth, okay, we call it the biting surface or the occlusal surface. And in case of anterior teeth, we call it incisal surface. We call it what? Incisal surface, which is used for cutting, and the occlusal surface is used for grinding the food, okay. And here we have in case of the canine, which is the longest tooth in the oral cavity, It's used for tearing the food, foods, okay? Contact points, we have contact points here, okay? So the contact points, it goes away while we move from from the medial side to the distal side. It reaches the moves downwards towards the gingiva, okay? It moves this way. These are the contact points. We have to know the contact points between the teeth, okay? So it's very important to know the midline. Again, let's look at, this is the midline, okay? This is really, and this is the mesial side, and this is the distal side. You have to know the mesial side and the distal side, okay? So I hope that today's topic was interesting, and thank you for listening today. I hope you have a good day. Thank you for now. Bye.